Hey everyone, welcome back to BioNexus Health Podcast. Today we are going to be speaking with the cardiology specialist nurse practitioner from New York City again. You know, something that she said recently to me, I felt it was important to share because, you know, most of us are working moms and dads, and there can be workplace exposure sometimes. And it is important to stay on top of that because remember, when you're being exposed at work, you're bringing the mold toxins, mycotoxins home, and you're spending so much time and energy and effort and resources in helping your children, in treating your children, treating yourself. Often I see everyone from a grandmother all the way to the grandchild. And it becomes a family affair. Everyone wants to get better. So it's kind of important to be alert to what environments you're exposed to. So allow me to welcome Larisa back to today's podcast.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hi, Larisa. Good to see you. Good to see you. So listen, let's talk about your workplace. You mentioned that you recently realized that you were exposed to the worst strain of mold that there can be, Stachybotrys or black mold at work. How did you suspect? What did you do to kind of confirm that? What happened?
When I started this work about a year ago now, I was only there part-time, 3 times a week. But in a few months, I noticed that I started having stuffy nose and also headaches. So initially, I just ignored it, thinking, maybe I didn't sleep right, maybe my cervical, my neck was bothering me. But then it started being more often. And the co-workers of mine were complaining of the same issue. One of them was taking 2 or 3 medications actually for her.
And sorry, for what? For her migraines?
Yes, for her migraines.
3 medications for migraines. Okay.
For migraines. And she said, oh, get used to it. When after 40, everybody gets migraine. It's just a normal.
Oh gosh.
Yeah, so I was like, I never had it in my entire life. Even when I was living in that moldy house, when it has aspergillus mold, I had different symptoms, but not headaches. So I decided to, like a few years after, thank God I took the filter that Dr. Dashore recommended, the Austin filter.
Yes.
It was there. And since it's a COVID pandemic still goes on, they asked us to masks, which I was wearing N95. And every time when I was eating, of course, I was taking it off and I was drinking tea or water. But when I got home the next day, I felt slight headache again or stuffy nose. And it was going on for a few months. So I decided to take Earthsmeet test, and I tested that particular room, and it came back positive for mold, for multiple species actually. And the most dangerous one, the black mold. And I've met also physical therapist in that office who was renting a room for 6 years.
Okay.
He has developed multiple autoimmune conditions, actually. So one of them was psoriasis. And he didn't know how to treat that, how to approach that. His calcium in blood was elevated. It was always like 10.2, 10.3, more than 9.5. I'm assuming.
Why was the calcium elevated? Why do you think?
I think it's because his adrenal glands, his parathyroid, that's what affected that. And I ordered his blood work and I showed it to him that he had 3 bands out of 5 positive for Lyme.
For Lyme disease.
Lyme disease, right. Yeah, which nobody recognizes a Lyme disease in New York State. If it's 3 out of 5, they don't pay attention to you. Say it should be 5 out of 5. So the guy actually believed me, and now he's looking for practitioner, to help him to to clean his mold, to clean his Lyme disease. But just wanted to bring to your attention, because sometimes we don't think that we're working in a moldy environment, but we have to ask our coworkers about the signs and symptoms. How do they feel? When I started that job, the women that were working there, they were like 55, in the mid 50s, and they were like, it's age, you know, when you're aging, everything comes to you. So headaches, the migraines.
Oh, don't remind me of aging, you know, trying to do it gracefully, right? No, I'm fine. I'm just kidding. But yes, you're right. You know, yeah, when you get to that age, everyone sweeps everything under, oh, I'm aging. Oh, it's quite normal to have 5 or 6 prescription medications, you know, like your coworker said, oh, you know, it's normal to have like 3 prescription medications for migraines. Well, hello, if one medication is not working, then you need to look for additional causes. You know, maybe there is something else going on in your environment. You know, another thing that comes to women at this age, like we were speaking before, is menopause, right? Menopause symptoms are, you know, there's a long list of symptoms for menopause. And unfortunately, neurodegenerative conditions like Parkinson's, ALS, MS, right? Also inflammatory conditions like borderline cancer that's beginning to grow, they can get confused with menopausal symptoms. So when you are exposed to environmental toxins, you have to be very alert. You know, dementia, pre-senile dementia, early onset, these can all get confusing with symptoms of premenopause, perimenopause, and menopause. So this is for all of us women in our age group to be kind of alert. But like you said, you know, most of them are not. And your coworkers actually thought that it happens.
Yes.
Yes. And then you mentioned that one of them said that, you know, around the vent, whatever the black they saw, that was dirt.
No, when I took a picture of what I saw, I sent it to the practice owner, because chain offices, you know, and he responded to me, but this is dirt, this is not mold. But immediately the next week, he sent the handyman to replace the tiles, you know, in that area. So he probably knew, or maybe realized that I was right, but he just didn't want to be sued, and didn't want to be involved in the litigations as far as the mold is concerned. So,
right.
But if I'm confirming, like I'm going to check my mycotoxins and marcons. If that's it, I'm leaving that place. And unfortunately, I wish we could check the workplace, the work environment before we take
I know.
That would be ideal.
Yeah.
For the future.
Yeah, it's hard, you know, and many people are in denial as well. You know, people think that when you have like ceiling tiles that are stained, right?
Yeah.
You know, sometimes there is drop ceiling. I remember speaking to a dad, you know, autism dad, and he's bringing this stuff home to the kid, okay, who is, you know, who has recently plateaued after remarkable progress in the beginning. So the dad is in the office, mom is at home, everything's clean and clear, but the dad is at work. And every time we have an appointment, that this is going on for like, you know, 2 appointments, it's like 8 months already now, that there is a very dark stained few ceiling tiles that I can see above him. And, you know, anytime I mention, right, there is this immediate response like, no, everything's fine. I've checked, blah, blah, blah. You know, so it's very clear the anger issues, the denial, you know, because he has to work in order to support his son with autism, you know, and he doesn't want to worry his wife, but it becomes a responsibility for the practitioner to point it out that, you know, just please be careful what you're doing. And it was very obvious from the way he had started to decline. I could see cognitive decline. So, you know, it becomes a very sensitive subject to approach this with the head of the family that, hey, you know, you're slipping. How do you say it? So the best way is like, please check your work environment. There are objective tests available, and there are remediations available. Something simple can be done as well, right? Small particle wipe down, air purifier, and if possible, you move.
Mm-hmm.
So that's another, but yeah, it's a very sensitive subject. Speaking of practitioners, I had one patient who was a behavior therapist. In fact, she had Lyme, and she heard me speak. This was Allison, and she came to me many years ago now, and she eventually became pregnant with Lyme, and she was a preconception and throughout conception, throughout pregnancy patient of mine. Her son was born cyanosed. And, with cyanosis, and I had to rush to the local hospital because the resident and the physicians didn't know how to handle a Lyme and mold baby. But he's doing fine. Colin is doing amazing. His brother's doing great. So anyways, when Allison was pregnant, she worked for a school district. And that school district, one day, someone came to her and said, Allison, we are going to move your office to the other wing of the school because this particular wing has had a roof leakage. Mm-hmm. And, we don't want you to be here. They didn't say anything else, right? So Allison is like, of course I knew that they must have found mold. But the sad part is that the wing that she was in had 2 classrooms full of autistic and special needs children. Many of them had asthma. Were they moved? Of course not. Mm-hmm. She just got a courtesy because they didn't want to get sued because she was pregnant.
Yeah.
So these things go on in the world. We had so many school districts here that shut down because of mold remediation, right? There were many schools and colleges and universities that during COVID, because they had time to investigate and repair and whatnot, they were shut down for months. It's in the papers, right? I believe Georgetown in Washington, D.C. shut down. There was Chapel Hill in North Carolina shut down. Chapel Hill actually had some new dorms built. This is very interesting, Larisa. You'll find it interesting. So this so-called new building, this was already 2 years old. They started to see an increase in depression and suicides. Oh, wow. And as the suicides started increasing, they started investigating, and they found that, the basement had flooded. And it was carpeted, and you know what commercial people do, right? They come and dry the carpets, like really. Mm-hmm. So yeah, the carpets were dried. It was all front-loading washing machines, which were flooded. So they were all moldy. And the kids were exposed to that. The furnace was in the basement, right? It was centralized heating system for them. So long story short, it was mold infested. So they shut down for remediation. Meanwhile, a few students lost their life, and parents lost their kids, brothers lost their sisters, and, sisters lost brothers. It was mind-boggling. And it was very scary for me because when I was investigating further, in fact, this nurse practitioner I mentioned to you in Boston, her son went to that's how I found out. And, as I was looking at the builder, oh my God, Larisa, wouldn't you know it? It's the same builder that has built this new construction rentals on Long Island that my son lives in. Oh. So, within 2 years, it got moldy because there was flooding and whatnot. I get that. So, you know what I did? The same builder has 2 new construction buildings across the street. So the one that is older, means it was built in 2019. I went upstairs, right? Rents are a little bit cheaper. So last year when the rents skyrocketed, I decided to go look. And oh my gosh, as soon as I exited the elevator, mold. I could smell it, because they have central air, Beautiful apartment building, but outside they have the water feature. There's one wall in the 5-story building that is all waterfall coming down, looks fancy from the outside. And inside, the air conditioning is blasting. I could see the black mold on the intake vents as well as the output vent. And I was like, my gosh. So he is in the newer building, which was built in 2020. Or maybe 21. I'm going to get him out. I'm in the process of looking for a small apartment that I can fully renovate so we can get him in there. So you just have to be careful.
Agree. You have to be mindful of.
Yes. Yeah. Not to mention that you're bringing all that stuff home. So. Okay, well, I'm glad that you were able to find it. I'm glad that you were able to, do the testing and whatnot. Yeah, we have air purifiers in every classroom in my son's college.
Wow.
As well. So I'm like, you know what? I don't mind donating. Someone has to keep track. And seriously, the facilities, they don't have a clue. They don't care. You have to stay on top of it. I was assured that the air purifiers were in and they were running. They were in, but they were turned off. And the one that was running had the filter on red. Like, what are you guys, blind? No, they just come, they bring the units, put it in, plug it in, and they're out. What is the rush? This is somebody's life at stake. Nobody cares. So yeah, it's up to us to take responsibility. Anyways, thank you once again.
You're welcome.
For speaking to me about workplace safety.
All right. Thank you so much for inviting me again, and have a good weekend. Okay,
well, that was a little bit intense, wasn't it? But it's important to understand workplace safety as well, especially when you're putting so much effort into your health and wellness. So thank you again for joining me. I will see you next time. Until then, keep smiling. Be well. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.